So the next slide shows this Wapper guide, and which I mean, when we talk about this field, it's most important that we are aware of that the whole clinical aspects are driven by the diversity of animals, isn't it? And so in the first step, we grouped these animal groups and also gave them different regions to reduce the huge amount of species which come into question, which could cause an accident. And then we tried to give in these days this mind map we established in 2012, and it works a bit like an algorithm, yeah. And the next step was then the idea that now where everyone uses a smartphone to transfer the information from the Wapper guide as database to a prototype app, which we wanted to establish in India. This is the front page when you enter in this app. The app is for free. You can download it. It's easy to download. And I want to talk first of the biological aspects. Then Thomas will show you the central flow of clinical management. And what we have here is, again, like in the Wapper guide, we start from the snakes. We decided to go on state level in India, because India is such a diverse subcontinent with deserts, mountainous regions, tropical areas, and so on. And we thought the state level would be quite good to distinguish between different batches of snake species. And you see it here are all the states, and the users have to choose one state where they are living. And let's go to Tamil Nadu because of our colleague before. Yeah. And then the app is fetching the information which is needed, which comes from the APIs from the Wapper guide, which is downloaded here in the app. And then we have different tools which are embedded in the flow afterwards, but you always have the possibility to look at them separately. Yeah? And there are things like how to use the Snakebite assistant, which helps on different levels. Thomas will tell you about the different levels of users afterwards. There's times in Snakebite, which is quite important to see how an envenoming develops. Sample approach, ABCDE approach, locate hospital. This will lead you to Google. And we have a set for snake identification. If the snake is not available, we have tools to make an indirect identification by the syndromic approach. Thomas will tell you afterwards. If the snake is available, there is a possibility also for lay people to make morphological identification of the snake. For sure, there's a warning. You should be able to distinguish between living and dead snakes, yeah, before you handle them. And even, as you know, dead snakes may be dangerous when you handle them. Don't handle them in the right way. So, and for most of you, this will be quite familiar. This distinction first is between sea snakes and terrestrial snakes with the tail. Then the next distinction is between non-venomous snakes, which have all nearly the same size of fangs. If they don't have the same size of fangs, then the next group will be the back-fanged snakes. Then we come to the elopid group. Let's go here to make it short. You see when you have this pattern here, there's one exception in India which doesn't show this pattern in crates on the back. If we go ahead, we come to the group of cobras or Calliophis. So let's go to the cobras, and here you can distinguish between cobras and king cobras. And here then you have the genus, yeah, of snakes, and you can go on and get some short informations about the clinic on the snakes. And also there will always be biological informations, very concise, so that the users can screen through very quickly. And always at the bottom you will find all the species which are living in the state, yeah. So, and there is also a possibility for the people living in a certain state to inform themselves about the groups of snakes which are living there, like cobras, Russell's vipers, king cobras. Then we have this possibility also to look at the other snakes which are not so important. And when I would press here, I would be directed to the VAPA guide, where these other less important snakes are listed. So now I give over to Thomas.
Well, thanks a lot. So the backbone, the snakes and snake distribution, Mauro has run you through. And because of time, I will run you now quickly through the management section, the main track of the VAPA guide. When you play around with the app, you can go to how to use, and you find a very concise sort of run through the app and the management section, which actually helps you to actually maneuver through the main clinical and combined biological procedures when you face a snake bite and venoming. This runs with start a new case, and you are made aware here that you should actually code and not put names, because after all it's an app application. Then you code your patient, you say age and sex, and then you have to decide, do I have antivenom available or not? So say we have antivenom available. Then again, you can here check quickly, when do I expect, in this case for Tamil Nadu and the spectrum of snakes which are prevalent in Tamil Nadu, when do I expect the various toxic effects, which starts with autopharmacological or immediate effects, local effects, bleeding, neurological, muscular, cardiac, and renal, the usual sort of range which we use in the syndromic approach. And then off we go. We follow the sample approach. Clinicians are very familiar with this one, which is actually sample as for signs and symptoms, then allergies, medication, past medical history, last oral intake and events. And again, to cut it short, you just switch it, and then you can write here what you have observed. The patient may have an allergy, you switch it and just enter the allergy. And this all will be actually compiled in your report automatically. Then you save and continue. And then already comes the clinical examination, which is straightforward. Your patient is awake, alert, and oriented. Blood pressure, say, is 100/60, and the patient is quite tachycardiac. It has a regular pulse, a respiration rate of 18, and so on and so on, which is your recordings, your clinical recordings. And now come the clinical features. Say your patient has a local swelling, he is bleeding from the gums, and he has ptosis. This is your finding. And further, you find that he has a reduced urine output. So this again, straightforward clinical assessment. You do a 20-minute full blood count test and it's unclotted. You can add the platelets, you can add the hemoglobin, which may be 12. And you do a urine stick test, which is positive. And again, you complete your clinical assessment. And now, you know, and this is the nice thing about this app, you have now in your observation tools all what you did so far with the sample approach and with your clinical recordings. You have here, you are in Tamil Nadu, India with your patient. This is your patient details. You said you have antivenom available. And now you have all what you actually said before or recorded. He's awake, alert, and oriented, blood pressure, and so forth and so forth. And here your main clinical finding is, in this case, local swelling, bleeding, and ptosis. And you said he has unclottable blood. And so you actually see right away, always with your patient, and this is automatically stored, so you can actually treat or manage 2 or 3 patients at a time and can move from one patient to another. If you want and see there is a necessity for short-term follow-ups, you can actually follow up your patient and put your timer, so your smartphone rings a bell, in this case after 30 minutes, to make you aware that you have to revisit the patient. You can put here the follow-up assessments. I don't want to go into this one because it's just the same sort of thing once again, which actually means you record your 30-minute follow-up clinical findings. So you have at all times recorded and also on your observation tools and your full report, the various sort of observations over time. 2 main features now to finish off. We follow, again, like the sample approach here, the ABCDE approach. All clinicians are familiar with it. So when you run with your patient into an emergency problem, you say breathing, oxygen, and then you get all what you need for your management when the patient gets into a breathing problem. And then you follow up further down. You have finished all your clinical recordings and you said, well, my patient has local effects, swelling, he's bleeding, and he has ptosis. And this is now the trick where you switch from your clinical findings into what Mauro already mentioned. In more than 90% of cases, of course, you do not have the snake available for identification. You use the, well, for clinicians, very familiar syndromic approach. And this is based on local effects, in this case, bleeding and neurological, because this is what you observed. And then you come to your list of snakes in Tamil Nadu for which the combination of local effects, bleeding, and ptosis is the best fit. And here you see quite clearly it's Russell's viper, which shows local effects, has bleeding and neurotoxic effects at the same time. This does not apply for the elapids and so forth. So say, yes, this is the most likely. I say, yes, okay, and this is the Russell's viper. So now you come to the specific actually treatment guidelines for the Russell's viper. When you are here in your clinical finding, of course, and this is what I want to finish off with a clinical presentation, of course, you have here 3 categories of venom effects. And then you can check the venom availability. And when you go to the antivenom availability, you'll find, well, the time is up. But since we started a bit late, I think it may be, if you give us sort of 2 or 3 minutes, that would be fine. And we apologize that the system was not running smoothly from the start. But it's not that easy to switch from apps to actually desktop presentations. Okay, then we have here the antivenom indications. And of course, you want to know how to treat. And you have the list of available antivenoms and dosage. And with an interface at a later stage, it will be very easy, you know, because we have programmed interfaces with our apps. There's one which we want to connect to, which is a photographic identification tool people in Geneva are developing, which can be linked. And you mentioned your anti-venom app. So this can be easily linked via an interface to this one. So we can replace actually the anti-venom list, which we have here, by your app, and can then use the same search tool. Then you find the anti-venom administration. And at the same time, of course, you want to know, well, which kind of anti-venom did I give? Then in milliliters or vials, I gave 4, and I applied all measures to prevent anti-venom reactions. So you did this one. And now the last step here. All this is recorded in your observation tool, and then you switch to the full report. And in the report now, all your various recordings and decisions, including your anti-venom application here, is actually recorded. And also information such as, well, how did I identify the snake? And here it says I identified it with the pattern of clinical finding with a syndromic approach. And the nice thing is you can then export the report and send it to the next level if the patient needs to be referred to the next level. And you see here that this case is recorded. So if I have at the same time another case, I just can start with another case. So I have 2, 3, 4, however many patients which I am looking after in a particular situation. So that's, in short, the main track, which is the clinical management track. I want to finish off with just making you aware of education and training. It has a big section on training for medical doctors, for hospital administrators, for students, for lay people, for the general public, so that they can actually learn about snakebite cases. And sorry about this one, I just wanted to go finish off. It has a game section, and it's a pity that we run out of time a bit, because for the lay people, we also have a game section where they can play around and can actually collect points and see how close they are at managing a patient at the primary healthcare level, or which we would have liked to show you, the victims and first responders, which is for lay people. So children, we tried it out in India, and they had a lot of fun with these games and playing around with prevention and identifying problems. So allow me to go to the acknowledgements. Well, the main group was actually Priyanka Kadam, who many of you know, who is running the SHE network in India. It's Mauro and myself. And now, not to forget, a big list of colleagues from India, of whom you know, I'm sure some of them well, you know, Ron Whittaker, you know, Dr. Ramana Rao, who is the 108 head in Hyderabad, Dr. Raghunandanan from Madras, from the intensive care unit there. And they all contributed generously to the workshop for the content development. We met many times in Madras Snake Park for workshops. And our special thanks also go to WowLab, which is a group of young app developers in Bangalore, and our web-based designers in Stuttgart, Unitas. And the two groups from Bangalore and Stuttgart, they worked nicely together to develop the interface. And now we want to move forward to improve this sort of interface between a web-based expert system and app. And the next step will be to develop an app for Sub-Saharan Africa, because the blueprint is there and it's only filling it with content from Sub-Saharan Africa. So we are very sorry that we overstretched the time so much, but this is due to the digital world. We are very much analogous people, Mauro and I, and we dared to move into this modern field, and it has its drawback.